Hi everyone. Everyone, we're getting started. Please grab a seat if you can find one. There will be more chairs. Everyone, yeah, we don't have a mic today, so sorry about that. Somebody said that that's right. Me using her whistle. So I'm sorry. I shouldn't have done that. Okay, chairs are coming up. Please continue to enjoy the wonderful refreshments from Morning Star. If you can, hold the chairs up here so we can hear. You can sit up next to me as well. Okay, we're gonna start with a public service announcement on COVID. Who is tired of COVID? Okay. However, there is a new variant of interest. Can anyone tell me what is the name of the variant of interest? Come on. It starts with E, right? It starts with an E, yeah. Iris. ERIS is a new Omicron variant. There is a huge surge in the Midwest and the South. If you have any relatives there, they may have to wear masks. Then it's not going to be mandatory, but it is spreading like crazy across the world and in the Midwest and the South.
And if anybody goes home with COVID, do not call and tell it.
Yeah, that's it. Now, it's still fairly early, as far as we know, and it's still no more pathogenic than Omicron. Means it's not as deadly as the original of the Delta. Having said that, please be safe. Please be safe. Rhoda?
Okay, everybody gonna hold down your conversation now because you can't hear Wesley. I don't know if you can hear me.
Thank you, Rhoda.
We're gathering in a couple more chairs for some of you. There's one chair over there. You know, kind of seat there.
Get some food, it's awesome.
Oh, thank you.
That's
Okay.
having you.
What's here?
Yes.
Sure, everybody say, let's all give.
We'll have more time for networking after the speaker as well, so definitely please continue to enjoy it. But just to wrap up on Omicron, it's being underreported COVID because no more free test kits. Okay, the federal government decided they're not going to give any test kits. So I know some of you are hoarding it. I'm hoarding 6 test kits. Do not come to me yet. However, does anyone know? For everyone's benefit, does anyone know of any providers that are still providing free test kits or free testing? Anyone know? Kaiser? Do you know for sure?
I got them like 2 weeks ago there.
Oh, really?
Yeah.
You just asked them and they gave it to
Well, I
you?
went to pick up a prescription for a couple times and they gave it to me.
Oh, okay, good. So if you're from Kaiser and if you ask, they'll give it to you. Good to know. Anyone else? No?
When we have someone that's supply base for you, I don't know, name for them, they come religiously.
Oh, really? So it could be the community that's actually providing it. Okay, that's good to know. All right, good. But definitely there's a search going on. So if you feel you need to use your mask, please do. I brought mine. I used it when I was coming in. So there you go. Okay, now I'm going to bring out the team of Morningstar. Come on out.
If you have not had a tour, please call Rhoda, join the community.
Are you going to do this? You tell them.
Let me see if I don't pass out before.
Okay. I told them that we'll give them 5 minutes of fame, which actually is just 1 minute. So keep going.
Okay.
Welcome everybody to Morningstar of San Tomas. My name is Ignacio. I'm the executive director, and I'm sorry there's not a lot of chairs. We didn't expect that many people. But there's plenty of food. Sorry. There's plenty of food. Afterwards, we can give you guys a tour. But this is my cadre, my team, and then maybe introducing themselves. Once again, welcome to Morningstar.
Hi, I'm Heather. I'm the business office manager here.
My name is Marcus Washington. I'm the Cadence.
Mark, I'm the wellness director.
My name is Jacqueline Calmarin. I'm the life enrichment activities director.
It's just so fun. I've seen her. Wait, what is that game? You say eights or
Crazy.
crazy?
Oh,
And some of you already know me or have met me. I'm Rhoda Takeda. I'm the Director of Community Relations here.
I'm Travis Reflections Coordinator.
thank you.
Oh, and Chef, you already get that.
Yeah.
You have a minute to talk about the community, Rhoda.
Oh, I get to.
Yeah.
Or not. Okay.
So we have 51 units. So we have 51 residents. We're memory care only. So if somebody has memory impairment, from my own point of view, oh, you see me after.
Yeah. Very memorable.
And we also have nursing staff on site. That's where Mark comes in as well.
Mark is an RN, wellness
Nice.
director, and we have LVNs on the floor. Our goal is to have LVNs 24 hours a day, so we can take a little bit of higher level of care for our residents. But in the meantime, we do have certified med techs, and we are working on staffing with LVNs as well.
Excellent.
Thank you.
Thank you.
Okay, are you gonna do tours after this?
Sure.
Okay, if you're interested to tour the community, I know some of you from competitors checking out the competition. Just take off your badge and see Rhoda.
I'm sorry, we're not competition. We are partners.
Or- All right, thank you so much.
Thank you.
Okay, I'm gonna bring up our speaker now. I know you've been waiting a long time to hear from her, so come on up. So first of all, I'm gonna do a quick introduction. Xiarong Ou, over here behind me, received her PhD in neurobiology from University of Southern California. Yay, go Trojans, I'm from there too. Researching the effects of aging on synaptic plasticity. She did her postdoc in molecular biology at University of Wisconsin-Madison, where she studied the structure function of a mechanosensitive channel, which I have no idea what that means. She joined biotech company Genentech and Science to conduct research in neuroscience for age-related diseases. How appropriate. Dr. O joined the Alzheimer's Association in 2012, currently serves as the Community Engagement Manager, Diversity, Equity, and Inclusion Research Champion of Alzheimer's Association, Northern California and Northern Nevada chapter. That's a long title you've got. So let's give her a warm welcome. She's gonna.
Hi everyone, I'm so excited to see so many people show up for today's presentation and
I'm sorry, I'm rude.
can you hear me? I don't know.
Probably
We
not.
can now.
I'm sorry.
I trying to talk really loud. So today, thanks for Wesley give me the opportunity to come here to talk to you guys. I'm very happy to talk something about the latest in Alzheimer and dementia research, and talk about how what's the latest progress, and also how you can get involved. Can I have, so Alzheimer's Association, you probably in this field, probably everybody already familiar with what we do. But can you go to the next slide? So we are a nonprofit organization. We trying to do our best to support the advances of research and also provide care and support with the for all those affected by the disease. And our mission is to have a world without Alzheimer's. Yeah. So today, I'm going to review the landscape of Alzheimer's dementia research in science, especially the latest what we have on the early detections and diagnosis, because many of you probably already heard about the latest approval of some treatments, and that make it more critical for people to have an early detection and diagnosis of the disease, because so far those treatment is only for MCI and early stage of Alzheimer's disease. And like in my more than 10 years I work in Alzheimer's Association, I know a lot of people that when they come to us or when they come to the doctor to try to find out what's wrong with them, a lot of them are already in the middle stage. So you will miss out all the benefit of the latest treatment we are available. So that's why we push for early detection. There was a lot of research going on, so it's a very exciting time now. And we also talk about right now the latest advances in clinical trial treatments and the lifestyle intervention. A lot of people, they probably don't have the disease, but they heard about the disease, how devastating it could be. And people are fearful and they want to know what they can do about it, to lower their risk. So we'll talk about some of those studies and how you can get involved with this study or clinical trial or involved with Alzheimer's associations, other things that you can do. Next one. So first of all, I'll talk about what's a dementia. So how many people know the difference of dementia and Alzheimer's disease? Raise your hand. Okay, a lot of people do. There's still some. So I will spend some time to explain. Dementia is a syndrome. That means a collection of symptoms. When you're talking about symptoms, it's just like how you feel there's something wrong with you, but not necessarily the disease. It's like when you have a fever, right? And then everybody knows that I'm sick, I have fever. But the fever itself is not a disease. You have to go see a doctor to find out what caused that fever. So when we have talk about dementia, let's talk about some problem with cognitive functions, but it could affect your memory, your language, your judgment, or your orientation, or your personality. All those things just as symptoms. You have to go see a doctor to find out what caused those symptoms. That's we talk about Alzheimer's disease is the major cause of dementia. So over 60 to 80% of dementia is caused by Alzheimer's. Right now, unfortunately, this is a fatal disease, and we don't have effective treatment for this disease. So there's a lot of research going on. And also, there's other kinds of dementia. So, like vascular dementia, frontotemporal dementia, and like Lewy body dementia. So, it's like probably the cause is different, but Alzheimer's Association support all those people affected by this dementia. Because when you, although it causes different disease, but for people taking care of the person that lives with the dementia, it probably is similar, the situation, how you care for the person with dementia. And also, some cases of dementia is caused by reversible factors. Some causes, like some people have depression, or they have dysfunctional thyroid. Some people have lack of some vitamins, and some people have some interaction from the medication they're taking, or some people just have something happen to them recently, so they could lose a family member or a very close pet, or something happened in their life, and they can show up with some symptoms that similar to dementias. So, and we also talk about mixed kind of dementia. So it's like the cause for this dementia is not caused by a single factor. A lot of people, almost like 50%, half of the people have dementia, have mixed dementia. They could have like Alzheimer's and vascular disease, dementia, they mix. So it's not just like one single disease that causes that. So next slide. So Alzheimer's Association have a report, facts and figure report every single year. So here is just some highlights from last year's, from this year's report. We know that in the United States, more than 6 million people is living with Alzheimer's, and we expect this number is going to double by 2050. And it costs a lot for the family and also for the country. So I think over 11 million of people that like doing those caring for people affected by the disease with unpaid, unpaid caregiver, those, yeah. And also it cost the country like over 340 billion this year. And I mean, I think it's last year, and it's going to be over $1 trillion by 2050. And also 1 in 3 seniors die from Alzheimer's disease. And the death is like, it kills more people than the breast cancer and prostate cancer combined. And for all the major disease, the death rate is decreasing, but for Alzheimer's is increasing. So also the death by Alzheimer's are sometimes underestimated, because when you go to when they die, when the doctor give out the cause of the death, they probably won't sign it as Alzheimer's disease. They would say pneumonia or something, because like for the end stage of the this patient, they are easily to get choked and get pneumonia, and they probably die from it. But the doctor won't say it, they die from Alzheimer's. They will say die from all the other causes. And so the number could be underestimated. Go to the next slide. So Alzheimer's disease is a continuum. That means it gets more serious over time. You probably studied with no symptom. Can you good? From the very beginning. So at the first, although there's no symptom, but it could be some change already happening in their brain. So now the research have shown that there's over like 20 years or more before any symptoms show up, they already have some brain changes. And then you think about how many people affected this disease, even when they have the early symptoms, they don't recognize it's a disease. They thought it's normal age, and a lot of people still think about it. And that's why I make our work more important. We do community education. We just go out to the community and talk about the early signs of Alzheimer's disease and make sure people recognize the early signs and see the, talk to their doctor or talk to their family and get a diagnosis early. And then you go to the stage 2 MCI, is mild cognitive impairment. And that's when you have some cognitive decline, but it's not affecting the major, like your daily activity, the ability you're doing things like live independently. But that's like if you go to see a doctor, they do some tests, and your score probably lower than you normally should be, but it doesn't reach the stage of a dementia. So this is called MCI. If you are diagnosed with MCI, you have a higher chances going to the later to develop Alzheimer's disease. And then in Alzheimer's disease, there are different stage. We say make it simple, make it early stages, the mild, moderate, and severe. So it's like the early, middle, and late stage of Alzheimer's disease, and the symptoms get more serious over time. Next one. So here is the hallmark of Alzheimer's disease. So there are two major hallmarks of Alzheimer's. One is the A beta plaque, extracellular plaques, and the other is neurofilament tangles that intracellular. And then it causes the degeneration of neurons, and that's the major time of your brain cells. And here you can see in the normal healthy brains, and then you see looks nice and healthy. And in the advanced Alzheimer's, because all the deaths of the neurons, and then you can see the brain has shrinkage that we call it atrophy, and those ventricles getting enlarged. So especially seeing the part in the where the hippocampus is, that's a big hole there because Alzheimer's, the damage started from hippocampus. That's the part that's responsible for learning and memory. That's why the early signs of Alzheimer's disease, people lost the ability to learn new things, and they can't remember the recent things that just happened. Like they cannot remember whether they have ate lunch or not, or they cannot remember. They just ask you a question just 5 minutes ago, and then they keep asking the same question again and again. And then, but with the disease progresses and the damage will spread out to the other part of the brain, and then more and more function get infected and affected. And then you can see the small symptoms showing up that they eventually lost their ability to live independently. They need like 24/7 care. So probably you guys are really aware of all those patients that how hard it is that when they have the Alzheimer's disease. Next one. So we talk about what's the risk factor for Alzheimer's disease. There are two kinds of factor. One is non-modifiable, like your age. Like Alzheimer's disease is a disease related with your aging. So the older you get, the higher risk you getting the disease. So you probably see more and more people getting the disease, and there's a couple of the reasons. One is like people in the past, they thought they ignore those symptoms. They thought this is just a normal part of aging. When you're getting old, you loss of memory. They didn't know that this is like more severe loss of the memory could be the early signs of the disease. And the other thing is with the advancement of technology and medical advances, and people live longer nowadays. So this is the disease, you get a higher chance to get the disease when you get older. And in the past, people probably died of other medical conditions before they get this disease. And now people live longer, and then more people like getting the disease. And then there's some other factors like the gender or your ethnicity, and all these affect the risk. It affects people of different groups differently. And there was another kind of risk factor that's like we call it modifiable factors. that's why we want people to know about these modifiable factors, and that means that you have control over it. You can do something about it, and that you can do something, change, get healthier choices of your lifestyle, or what you eat, or how you exercise every day, and all these things can help you reduce the risk. So modifiable risks include substance use or medication you take, or the education years, how many years of education you get, and whether you have a brain injury. Like people have injured their heads earlier in their life, they have a higher risk of getting the disease later on. So those professional boxers or American football player, because the repeated concussion to their brains. And then later in life, they have a higher risk. So why it is important to protect your head. And also, we said your heart and the brain is related. What's good for your heart is going to be good for your brain. So exercise, cardiovascular health, you maintain a healthy. If you have diabetes or you have high blood pressure, overweight, you should control those numbers to a healthier level. And then getting enough sleep is very, very important. There's a more and more study saying how beneficial sleeping is. It's not a passive thing to do, just sleep. Because when you sleep, your brain's doing a lot of things. So one part of it is like kind of cleaning out what's the waste in the brain, and they cleaning it out during your sleep. So it's important. And also diet. And social engagement is also very important. In recent, we just have Alzheimer Association International Conference last month in Amsterdam. One exciting report is how study is like show that people doing volunteering is actually the benefit of their cognitive health. So they slow their cognitive decline. And next one. So this overall risk, we still have a lot of study studying it. It affects like different groups of people differently. We still have to look at all kinds of angles and to assess this risk and how we can find out some like intervention to improve our brain health. Next one. So here talk about the disparities between gender, race, and ethnicities. So almost 2/3 American with Alzheimer's is women. So women have a higher risk than men. And also Black and Hispanic have a higher risk than compared to white to getting the disease. I think Black is like 2 times the risk of the white, and also Hispanic is 1.5. So all these differences, there would be a lot of reasons. I don't know if it's genetics or if it's like socio-economical differences, or their whether they are taking care of their health and their ability to getting good education, or taking care of their health, and when they have other disease and all these things, and it could affect their risk. So this is still under study, and unfortunately those ethnicity groups that they are not as representative in our clinical trial in a lot of study. I think the majority those that sign up for clinical trial and research still are white people. So we encourage people of different background and ethnicities and also, sign up for research. And that way we can make sure whatever solution or intervention we discover is going to benefit for all people. We talk about research. We say nowadays is the exciting time for research. Like every day, every moment that progress is making. Next one. So Alzheimer Association is pushing that for advances of the research for Alzheimer and related dementia. We are the greatest nonprofit organization supporting Alzheimer-related research. It's the biggest for nonprofit organization, and even for all, it's like the biggest one is the Chinese government, the second one is the US government, and the third one is Alzheimer's Association for funding research. So we are behind all the advances that we understand the disease and finding intervention to help those affected by the disease. And we support a lot of the research projects around the world. Can I go back to the previous slides? So currently active research support that Alzheimer's Association support is like over 220 million. And we support all over the world for projects like over 1,000 projects in like 54 countries. Thank you. And then besides Alzheimer's Association support, we also like have our volunteer, especially those advocacy volunteers, to try to influence the government to make them give more research funding for this disease. So from the time to 2013 to now, in about 10 years, the research funding for Alzheimer's and related dementia from NIH is like increased by about 7-fold. So it's a big increase. And we thank all our volunteers and all people involved. So if you like to involve and let us know, we need volunteers all the time. Next one. And also in our communities, that's like in California, we have support research from UCSF, Stanford, and University of Southern California, and Gladstone Institute, and Cedars-Sinai Medical Center in Southern California. And we have a total award of 423 projects just for California alone. And from year 1993 to 2023, we have supported all this total amount is like over 110 million for this research project. And right now the active grant is like 55 million. And we have a lot of for those grant receivers, we have a review from those experts in the field to help us review those proposals, and then we select those like a lot of the slides that probably not funded by NIH, and then we study a lot of high-risk research. So a lot of the advances that we see today is actually studied a lot by Alzheimer's Association's support. And because of the Alzheimer's Association support, we're seeing a lot of people from other fields, not necessarily from neuroscience. And last year when I went to the AAIC conference, I met a lot of the research that getting the Alzheimer's Association's grant for that project, and they talk about they are not in this field, but because like the Alzheimer's Association offer this research grant, and they are able to study looking at a different angle, not the traditional neuroscience, and study the age-related neurodegenerative disease. And we see a lot of new posts cross-disciplinary and different field, and then so we see a lot of making a lot of progress, attracting a lot of talents to come to our field. So it's a really exciting time. We see how the world come together to tackle this problem and this disease. So one of the biggest highlights I have to say for the research exciting is like for the early detection and diagnosis. Alzheimer, unlike other disease, like if you have diabetes, you do a blood test, you will know you have the disease or not, right? But for Alzheimer, it's much more complicated. So it's important that we understand better of the underlying mechanism of the disease in order to get a right diagnosis. So the benefit of early diagnosis is you understand the symptoms. I met a lot of families that because they didn't know that their dad or mom had the disease, and they probably have caused a lot of family conflicts because like, why she's behaving this way, why she say those mean things to me, if they understand that the person has the disease, they probably will, behave differently in their family. So a lot of family tell me, oh, my mom probably have the disease like a few years now, and we just got the diagnosis, last month, and they noticed the symptoms long time ago, but they didn't think about to go see a doctor. We want to do this education. We want our community, all these people to know how those early symptoms look like, when you should go see a doctor. So the early diagnosis is very important. It gives the family enough time to learn about the disease and make some early planning for the care, like legal and financial planning is important. We know how caring for somebody living with disease is super expensive. Probably you guys know better than me. You are in this field. So it's important to plan for their care in the future. A lot of the seniors nowadays, they live alone. They don't live with their families. So when they are healthy, it probably is okay. Their kids will come visit them in the weekends. But if they have Alzheimer's disease, they have to think about there will be time for sure they cannot, take care of themselves. Somebody has to help them, or they have to find a place to live that can care for them. So it's important that they do this early planning for their care. And also we want people living with disease that make their decision, express their wishes, and let their family know what they want for their care. Who they trust to, make decisions for them when they still could. To make this wish known. So who can make decisions for them when they no longer can make those decisions, and who they trust. So, and actually, early diagnosis will bring up a better outcome of the care, and family care them better, and and also have a more effective when we consider the cost of care. Next one. Tia is talking about how modernizing the diagnosis process. Like in the past, the doctor probably had to look at what symptom they have. Like when the patient comes to see a doctor, what symptom they have, they experience, and also ask about their family history. Do they have a family member have the disease? So those diagnoses probably come right in the green areas. But research have shown the change in the brain is 20 or more years before the symptoms appear. So how can we detect it? So why nowadays we don't have effective treatment for Alzheimer's disease? One of the reasons it could be when they find out they have the disease, it probably is too late. The intervention coming too late. So when you are here, you give some drug and whatever, and there's nothing they can change. So we want to intervention will be early when the brain starting to make some changes. That's why we have a lot of research in the biomarkers. So how we can look for the brain changes at the earliest moment when there's no symptoms, and we get a better hope of finding a intervention that can, modify the disease progressions. Next one. So biomarkers is changing the game. So it's like we make a lot of progress in research that finding out biomarkers that potentially can use. One is like the biofluid. Probably in the future, you can just go see a doctor and just get a blood sample from your fingers, and then people can, look at like some indication what has changed in your brain. So there's a lot of research on that, and also brain imaging and other potential markers. Next one. So we talk about what's brain scan. Brain scan, PET scan is like positron emission tomography. It's to scan your brain and see if it's like there's some changes. So nowadays, there's some FDA approval brain scan that can look at the amyloid level and tau level in your brains. And this information is not going to be a definitely diagnosis, can make your disease, but will help to make the diagnosis, because there's a lot of things go into the diagnosis of Alzheimer's. Next one. So here is on the idea study, and also some new idea study that have used that making progress. It's like the study, idea study is like information is gathered from a population that how this with the images that can help with the diagnosis of the disease. And but those studies have underrepresented in some ethnic groups. So we have a new idea study that recruits that those underrepresented groups into the study, and making sure that this study's results is also covering all ethnicity with equity. Next one. We talk about one of the exciting thing is like biofluid as the biomarkers. So it could be cerebral spinal fluid. So with the tap in your spinal, and also the blood test is like people studying. So right now we have one FDA approval amyloid CSF test. It's on the market for Alzheimer's.
Excuse me a sec, I need to make an announcement.
Oh, sorry.
Okay, sorry to interrupt you, but if anybody's parked along this other building, but the blue building, over here, you need to move your car, because she's gonna tow it. So if anybody has any cars, there, can you please move it? The back of our building's fine, it's across, in front of our building, L shape, but bluish
I
building.
think we're okay.
So sorry.
If you're along the fence, you're okay, right?
Yeah, you're over here, but if you go along by her building, that L shape where it says reserved, in those spots, fortunately.
Let's give a minute and then we'll take a break for 5 minutes. Let them come back. Go ahead, refresh yourself. She's not done. She's coming up with the exciting stuff. So 5 minute break.
It's fine.
Where did you come?
I don't know what, probably some of people already really understand the things.
This is
But
on
we're
you,
still
yeah.
streaming, by the way.
Oh, we're streaming? Okay, all right. Can you pause the stream? I'll let them know. I'll tell them.
I'll just leave it.
Just leave.
What
Hi,
else can we do?
everyone on the live stream. We're taking a quick break, 5 minutes. We'll be back. Don't go away.
She's been checking the stream.
Might be a little social, yeah. Much longer. No, I'll go out. Same basic.
We're gonna start this soon. I feel about it. I just have to follow along. Okay, everyone, come on back. We're restarting. Come on back, grab your seat. There will be a quiz after this. Donna. All right, have a seat. We're gonna get started again.
Okay, so I'll just continue. Welcome back. So we talked about all this new era of diagnosis, and especially for the biomarkers with the biofluid. So basically, blood and CSF. We still need more study on this one. It probably still will take some time till we have developed something, some standard, and the test would need to be repeatable and it makes sense. It will be so until we have a standalone blood test that can use in the primary care setting. So maybe sometimes you hear some news or even some company offering some blood tests. You just to be more careful because those are probably make sure it's FDA approved and make sure that the test result is appropriately interpreted. So the test and what does it tell you? It doesn't say whether you will have the disease or not. So that won't be useful. It just like make it a lot more of an emotional burdens for the people getting some high risk like disease, but it still didn't tell them whether they will have the disease or not. So it's important to consult with your physician when you decided to do some tests. And yeah, next one. So biofluid is very likely will be the future of diagnosis, but it probably won't be the standalone test. It probably combined with others. So we probably will still need for brain image, the PAC, and combine all those tests that the doctor will do to exclude all those other reversible causes of dementias. So another, besides biomarkers, another important study making the news is that how we can, reduce our risk to get this disease. It's probably more important for us, we don't have the disease yet, but we are worried about this disease. But what we can do, and there's a lot of study, it's like right now research has shown about 40% of dementia is preventable. Think about it.
Wow.
So we can do something about it, and then to make us have a lower risk to getting the disease. This is very good, right? So we have to find out what we can do. It's not that hard. So you need to exercise. So I mentioned what's good for your heart is going to be good for your brain, right? So anything good for your heart, exercise, right diet, to control your blood pressure, your cholesterol numbers, and your diabetes, and all those in good control. And also, if you're overweight, you probably should lose some weight and getting a good sleep that I mentioned earlier. Other things, volunteering. So it's social engagement is very important. So I always encourage you to challenge your brains all the time. It's not necessary you have to go to the school or do something like play some like very serious game. But just like when you go out for a walk, choose a new route. Okay, so you explore the routes option. If you like to read, find a different kinds of book. So it's kind of challenge your brain. Anything that challenge your brain is good. You can, play games like mahjong, a lot of people, or bridge or something. So it's a good thing. Not only challenge your brain, when you playing games, you always with friends, right? So you talk. It's a social engagement, and you have to memorize, what other people have, all the cards, and then all those is good for you. So for exercise, and sometimes you don't even need to go to the gym to exercise. If you don't like to just walk around the neighborhood, you can go to a mall, just window shopping. I always tell people, just like go with some friend and window shopping. There's a big mall, and then you can walk like an hour. You feel like nothing, right? And then it's fun. Or sometimes some small things you can change. Like when you go to a parking lot, when you pass something, you want to get the closest spot, and then you don't need to park far away. There's a parking space, and you just walk a little, a few more steps. If you go upstairs, you don't take the elevator, use the stairs. Some people probably live in a big building, like they have 10 floors. They cannot walk those stairs to 10, but get the elevator to the 6th floor and then walk up to 2 more. So those small things, you can incorporate into your life. It doesn't have to make a big effort. Just consciously know that you need to do those things, and then just do something small, and then keep it. Next one. So there's studies that is called the U.S. Pointer study. Is study initiated by Alzheimer Association. It's a 2-year study with multi-centers in the U.S. That's 5 centers. We randomized the 2 different groups. So we right now already recruited like 2,000 participants. And then those people have like used different lifestyle, and we want to find out if those lifestyle intervention is a good solution that we can, it's low cost. You can do it in a lot of the community and easily. So see if it can help reduce the risk of getting the Alzheimer's disease and related dementia. And besides the Alzheimer's Association supported pointer study, the NIA, National Institute of Aging, also supported some Other studies is like pointer neuroimaging and pointer sleeping and pointer neurovascular and pointer microbiomes. And all this study can support we are very, very exciting, you know, pretty soon we will know more about all these lifestyle changes, how it will affect our risk. Next one. And then the US pointer study is not alone, and actually it's a whole world effort. If from this map, you can see the purple is currently countries and regions that is already implementing the finger-like study. And then those yellow one is the one that is in the phase of planning it. So you see, it's all over the world. It's a worldwide finger is a large international network. They share their experience and their research data, and then it collaborating to how we can, you know, improve our cognitive when we age. We want to talk about treatment discovery. Why do I want to talk about it? Because we oftentimes hear in the news, oh, they discover things, and then the next week, and then we will get a lot of calls and ask them, how can I get it? And then I have to explain to them, you know, it doesn't come overnight, those things. So when they report a study is potentially is going to be useful, it probably from an animal study or cell culture study. From those, and then you go to the later when it's promising, and then you go to the clinical trial that you test on the human beings. And then there's different types of phase of the clinical trial. The first phase 1 mostly is for the safety, and then it's a small scale. It takes months, and then if it's positive, it's safe, and then you can go to the second phase. And then you get a bigger scale, and then you can try different doses and how effective and different doses are how long, you know, dose effect is better than assistant, you know, treatments. And then you go to the third phases, and that even takes longer. It could be more years, and then involve more people to participate. And those like after all these 3 phases result is positive, and then you kind of submit it to FDA for approval. So this whole process takes years, you know, if not decades. So that's why when we hear some news, and then we want people to understand this treatment, promising treatment doesn't come overnight, and you can talk to your doctor and where can I do this test? No, you can't. So and it's a long process. It takes a lot of time, and it takes a lot of money, and more importantly, it takes a lot of people to involve. So for clinical trial and for the treatment for some disease, it not just like needs funding for the research. It needs people to participate in the research, especially in the clinical trials. So it's like it's the major obstacle besides funding. It's not enough people enroll in clinical trials. Next one. So for Alzheimer's, the currently FDA improved treatments for all those years before 2020, we only have drugs that can relieve the symptoms, but do nothing about the disease progress. So from a couple years ago, we first have the treatment method that target one of the hallmarks of the disease, the A-beta, amyloid beta, that form those plaques in your brains. So they use the monoclonal antibody so to create your brain of those plaques in your brains. So there was one is Aduhelm that's the first approved with accelerated approval in 2021. And then there was another drug, it's the same class, it's also a monoclonal antibody against A-beta. And it's approved early this year. It's a regular approved. It was it was approved at first with the accelerated approval that the FDA have like a decision that they're not going to cover it. It was like Alzheimer's Association like in an all-out effort to advocate for the FDA to cover this FDA approval drugs because it never happened before. An FDA approved medication is not covered by Medicare and Medi-Cal. So now it's covered if you enroll in a registry so that they will continue to monitor the effect of the drugs. So this is a monoclonal antibody. It won't cure the disease, but it's a good start that it gives the people affected by the disease more time because that's what I talking about earlier about early detection is important because this kind of treatment is only effective for those in the MCI stage, that's mild cognitive impairment, and also early stage of Alzheimer's disease that with the plaques. So this is the Aduhelm and Lecanemab. That's the two monoclonal antibody, and one more is in the canine that is expecting the submission to FDA approval later this year. And although you heard about all the anti-amyloid, but that's not the only clinical trial is going on. There was over 140 clinical trial. It's being tested in clinical trial for different targets, not just for the beta amyloid. So what you're seeing here is here just for the beta amyloid. And there was a lot of research going on the tau, and that's for the neurofilament tangles in your neurons, and also cellular communication, and also protein misfolding, and neurotransmitters release, and epigenetic regulation, and bioengineering, and those mitochondrial different mechanisms underlying the aging process and the disease mechanisms is under study. So it could be oxidative stress affecting your cells, and also those mitochondria and microglia, and also could be a vascular stress. We know how our heart health affect our brain health, right? So we want better understanding how it affected it. And also information, it's important. So neuroinflammation, how it affect the people's risk getting the disease. We talk about how brain injury and your head injury affecting your risk, how they affect your risk. We need to better understand it. So all kinds of study is going on, but you probably will never hear it. All you hear is about A beta, right? And I have people email me and say, "Oh, Alzheimer's Association, you cannot just look at the A beta. You need to look at other things." And they just didn't know there was other people not in the news. It's still going on. So next one. So every study help scientists understand better of this disease, and there's an urgent need to have an inclusion of individual underrepresented communities. So we want whatever intervention, whatever treatment we find out is going to be benefit for all people, not just the people, traditional small white people participate in the clinical trial and it's effective. We want those treatment is going to be beneficial to all people involved. So we need to encourage people of different backgrounds to get involved. And right now, Alzheimer's Association have a program to help people to sign up for clinical trial. If you go on to the NIH's website and you look for a clinical trial, there are probably like thousands of clinical trial. Which one you should pick? It's hard. And Alzheimer's Association have these services. It's a free services that match up your interest with the study that's like match your criteria. And this clinical trial, the trial match service is free, and there's over 370 users, and it has like over 750 clinical studies in different locations around the world. And we just, when you sign up at the Alzheimer Association website, sign up for it, and we will send you an email that match your interests, and then you can pick from those and make it easier for people to get involved in clinical trials. Yeah, those are the numbers of how many clinical trials is going on for different disease or different type of dimension. And we want you to know, if you want to learn more about research, want to learn more about Alzheimer's Association, want to know more what kind of support in the community, go on our website and or call our 800 number. This 800 number is 24/7. You can call anytime, anywhere within the United States. There's always some people answer your phone calls. It's not an answer machine. We have 24/7 staff that's at least a master degree clinicians answering your questions. And we have a lot of caregivers that call us in the middle of the night, like early in the morning at 3 o'clock or 4 o'clock, when the patient already go to bed and they just need to talk to somebody. They get so frustrated. They don't know, they don't have any, social network to support them. They can call us. They don't have that. They don't have to have a problem to ask. They just can, I want to talk to somebody. You can call us. There was somebody answer the phone. And they don't even need to speak English. There's over 200 language translation over the phone. So just tell them you speak Cantonese, you speak Vietnamese, and then they will find a translator to help with the phone conversation. So this number is so useful. So just write it down. Or in any of our Alzheimer's Association material that will have this website and phone numbers. And I think in summary, Alzheimer's Association is a leader in research in this field, and right now it's the very exciting time. And if you want to get involved, just let us know. And I have a lot of materials on the table. I have my card, and besides similar presentation like today, we have a lot of community education that's free. We can offer it in English, in Chinese, in Spanish. Just let us know. We will be happy to do more presentation in the community to help people get a better understanding of the disease. It could be like, what's the 10 warning signs in Alzheimer's? So help people. Or it could be, how do I bring up the conversation about dementia? You notice some of the family member or friends around you that have the signs, but you don't know how to bring up the conversation. Sometimes it's very hard. We give you some tips. It could be some, like, they already they have no problem at all, but I just want to know, what can I do to reduce my risk? We have a healthy living for your brain and body presentation. It could be somebody already have some have the disease at home. We have some caregiver trainings. We have living with Alzheimer's for early stage, for middle stage, for late stage. We have presentation, effective communication strategy. How to communicate with a person living with the disease at different stage of the disease. It could be different. In the early stage, you probably still can use language. In the middle stage, you probably had to, show them how to do things. And then in the late stage, there's another kind of the tips that we can give you, how to communicate and still get connected with the person already lost memory, already lost the language ability, but you still could connect with them. So also for a lot of family, they find it very useful is understanding and responding to our dementia-related behavior. So we have those classes for caregivers. So all these classes are free, just like go to look at all these different topics. And then if you know any group in your community is interested, just let us know. We are happy to come out to do a presentation.
Thank you very much, Dr. O, for sharing all that information. Like I said, there is going to be a quiz, and I'll be handing out the test. No. I know we're kind of running out of time, and I'm sure you have questions. I have a bunch for her. So, given that we are running a little behind since we took the break, if you have questions for her, come on up before she leaves, and we can, as a group, just talk to her and ask any questions. So, come on up if you want to talk to Xiarong. Otherwise, Rhoda, you're gonna do
I'm gonna do
the
a drawing.
raffle. Yeah.